I want to walk you through 4 important facts about the Affordable Care Act that will help you in selecting the right coverage for yourself. First thing that I think is really important is that the Affordable Care Act covers you regardless of your pre-existing conditions. I think that's fantastic because all of us were hesitant, oh, maybe I'm not going to be covered or accepted. It's not going to matter anyway. And when they established the Affordable Care Act, that was one of the important pieces of the legislation was, let's make sure everyone is covered regardless of their scenario. So whoever you may be today, no matter what your age, this is a really important thing to know that you will be covered under the Affordable Care Act. Another important thing to understand is it's called the Affordable Care Act. What does that actually mean? For younger professionals, it can be affordable coverage because the way they determine the premiums is actually based on your age and whether you're a smoker or not. So that could impact it. But the younger you are, the more affordable it is. And then usually when we're younger, we're not making as much money, and we can qualify for more tax credits. So if you're a younger professional, 25, 35 years old, somewhere in that age range, know that you could get this coverage without busting the bank. Another important thing to know about the ACA is recent legislation over the last couple of years has actually increased the amount of income that you can make to qualify for these tax credits. So maybe you compared and you looked at the coverage a few years ago and you're like, well, this is just too expensive for me, and you've made the decision to go without health care. We don't want anybody to be without health care. With these higher income brackets to actually qualify for tax credits, you really need to take another look at how the Affordable Care Act could give you good coverage that also fit your wallet. I recently met with somebody who really wanted to stay on their Affordable Care Act plan because of the tax credits. But what we had to explain to them is that when you become Medicare eligible, you actually lose access to those credits. You no longer qualify for them. And then there's a few other rules that you're not allowed generally to stay on that coverage when you become Medicare eligible. So that's when we help you make the transition to what the costs and coverage would be with Medicare. Obviously, there's more facts, and you may even have more specific questions. Reach out to us and we'll be able to help you walk through this process.